Local physicians say measles is one of the most contagious viruses, putting children, elderly, and immunocompromised patients at risk of infection. The symptoms of the measles include the 3 C's, according to Baptist Health pediatrician Dr. Jay Gilliam. That's cough, congestion, and conjunctivitis. Retired family physician Jeff Fox says there's a distinction to this respiratory virus.
It's followed by generally a rash, and the rash is a light red in nature, usually starts on the face and spreads down.
The measles exposure in Grant County happened at the Ark Encounter and a Holiday Inn in Dry Ridge. State officials say the out-of-state carrier was not vaccinated.
One individual can infect up to 12 to 15 other individuals who may not be immunized.
There's no antiviral treatment for measles. Dr. Fox and Dr. Gilliam say the disease can cause rare but serious, lasting complications.
Encephalitis, brain swelling, pneumonia, sepsis, death. These are complications that can easily be avoided.
I want to emphasize the way to prevent all this from happening is vaccination.
State data shows 13 confirmed measles cases in Kentucky in 2025. Dr. Gilliam says cases are rising as fewer people get vaccinated.
Over 2,000 nationwide now have had measles cases. Now, to just put in perspective, we have not seen numbers like that in over 30 years. That's very unprecedented and very alarming.
During flu season, Dr. Fox says anyone with these symptoms should consider testing for measles. In Lexington, Madison Porter, WKYT.